Hello, everyone. It's November the 19th, Friday. I apologize. We've been all over the world today. We've been to Grafton, to Peyton City, and lots of driving. And the state police took us on some scenic routes and everything. But nevertheless, I sure appreciate you still being with us. And I'm going to start off regretfully again reading 28 great West Virginians that we've lost, but if you'll just bear with me and please keep these great people in your thoughts, your prayers, and show them your honor and your respect, please. The 4,699th death of 73-year-old female from Raleigh County. The 4,700th death of 58-year-old male from Nicholas County. The 4,701st death, a 74-year-old female from Putnam County. The 4,702nd death, a 63-year-old male from Webster County. The 4,703rd death, a 45-year-old female from Kanawha County. The 4,704th death, a 62-year-old male from Preston County. The 4,705th death, a 78-year-old male from Kanawha County. The 4,706th death, a 71-year-old female from Preston County. The 4,707th death, a 77-year-old female from Ohio County. The 4,708th death, an 86-year-old female from Barber County. The 4,709th death, a 56-year-old male from Wirt County. The 4,710th death, a 77-year-old female from Marion County. The 4,711th death, a 62-year-old female from Putnam County. These I really hate. The 4,712th death, a 36-year-old male from Marion County. The 4,713th death, a 54-year-old male from Putnam County. The 4,714th death, an 80-year-old female from Wood County. The 4,715th death, and a 68-year-old male from Mercer County. The 4,716th death, an 81-year-old female from Wood County. The 4,717th death, a 78-year-old male from Mineral County. The 4,718th death, an 87-year-old male from Harrison County. The 4,719th death, an 85-year-old female from Fayette County. The 4,720th death, a 53-year-old female from Wood County. The 4,721st death, an 83-year-old female from Harrison County. The 4,722nd death, a 72-year-old female from Marion County. The 4,723rd death, a 75-year-old male from Cabell County. The 4,724th death, an 81-year-old male from Ohio County. The 4,725th death, a 69-year-old female from McDowell County. And the 4,726th death in West Virginia is an 81-year-old female from Greenbrier County. Again, I really sincerely ask for your prayers. Over the Thanksgiving holidays, these families are going to have a tough go of it. We have 7,275 active cases in West Virginia. We have 1,363 new positive cases today. Our daily positivity rate's at 8.80. Our cumulative positive is at 6.18. We have a little over 275,000 that have recovered, 511 in the hospital, 173 in the ICU units, and 97 are on ventilators. We have 26% of the hospitalized people in West Virginia have been fully vaccinated. That's a problem because really and truly, what they've been is they've been vaccinated and a great many of them have just failed in getting their booster shot. And they need to get their booster shots, and they need to get them really quickly. We do have 3 green counties in the state, but here's the really bad news. We've got 22 red counties in West Virginia right now. 29 outbreaks in our school communities and 17 29 school outbreaks in 17 counties with a total number of 435. Just reminders real quick, 65 and older, any symptoms whatsoever, please get a test. The antibodies are waiting for you and they'll save your life. 65 and older and any kind of health condition, really think really hard about wearing a mask indoors. Jordan, have we lost the signal, or it's showing we've lost the signal on my screen? Okay. Okay, the other day, I kind of went on a little bit of a rant about these booster shots, about telling you over and over that, if you're 18 and above, that you qualified, go get the booster shot. The CDC and FDA had not, issued anything that said 18 and older. I said they'd do it. Sure as the world, this morning, the FDA approved booster doses for all Americans over 18 years of age. We're still waiting on the CDC to give that approval, but FDA has already moved, and I'm sure that CDC will follow suit. If I could just touch just briefly about the booster shots one more time. If you're 18 and older, absolutely you ought to be getting the booster shot right now. Quit worrying about whether you qualify or not. Just go to your pharmacy or health center or whatever it may be and get that booster shot. For all practical purposes, everybody qualifies, and now the FDA is saying give it to everybody. Hopefully, the encouragement that we have given from West Virginia maybe help move the needle a little bit here. But absolutely, without any doubt, you will help us with the number of hospitalized people, take the pressures off the hospitals, and absolutely, do any and everything you can possibly do to not get yourself in a hospitalized position, and then on from that to who knows what could be really tragic. If you lost your card, contact DHHR. We'll get you another card. Eligibility is 5 and older. We ask our grandparents and parents over and over about getting our kids vaccinated. We need to do so. All the information is up on the COVID vaccine hotline or info line. Today, like I said earlier, we've been to Grafton High School, we've been to Peyton City. We've absolutely had the opportunity to see some wonderful kids, and as well as administration, teachers, service personnel, all those great folks that make it happen every day. These communities, really rolled out the red carpet for us and everything. A lot of people ask all the time, why do this? Well, first of all, it's really worked as far as getting people vaccinated and making people more aware. But more even than that, a governor really needs to be with the kids. I mean, for crying out loud, a governor that just sits in Charleston all day long and everything. I'm all over the state. I'm really proud of being that. And I want to be with our kids. Our kids are our future. They deserve to see their governor and listen to their governor. And so yeah, it was great stuff, and we really enjoyed being there. Did you have any pictures, Jordan, of that today? I guess this is at Grafton, and do you have the Peyton City one? Well, I'm going to move on, and we'll come back to that maybe in a second. We announced, our baby dog round 3 prize winners today, and we held back on the school, that is the prize winner and everything. We'll be doing that later on, and we'll make that up after this up and coming Thanksgiving week, deer season, or whatever. I remind you over and over about you taking advantage of our free testing, and again, I thank Frith and Walgreens for all that they do and have done. We have 45 outbreaks in our long-term care facilities. We have 3 active active outbreaks in our church community in 3 counties, counties. That's Mineral, Nicholas, and Webster. We have a total of 22 cases. That's eking up a little bit. We need to tighten up a little bit in that church community and everything, because we know how bad that can get. We have 67 inmate cases and 19 staff cases. I remind you about taking the flu vaccine. You know, you can do it at the same time you take your COVID shots. I tell the people all the time, you know, the renters and the landlords alike, you can absolutely get some real dollars in your pocket. If you've been harmed by COVID and you're under financial issues or financial stress, call us. Call us. We've got a bunch of money in a bucket that can come your way if you qualify. $150 voucher to our grand families, and we need to keep getting our kids across the finish line there. The recognition trees that Kathy and I are inviting all West Virginians to honor members of the military and first responders by submitting these photos and everything, and we'll display them right here in the West Rotunda and of the Capitol building, and along with the two trees that are recognizing these great heroes that we have. There'll also be a third tree that'll be decorated by Gold Star mothers and families to honor their loved ones that have sacrificed everything for this incredible country. You know, all the information about how to send your photos in and everything is up on our website. The Challenge Academies. Today is a milestone. Now they have graduated 5,000 people since the beginning of the programs in 1993. Today, the graduating class of 106 cadets, you know, was part of the class 2 for 2021 at Camp Dawson. Here's a great statistic. 91 of those cadets will graduate with a high school diploma. Really good stuff, and all of us are amazed with the great work that is done there, and congratulate the Guard and all those that are putting in the licks to make all that happen. Hunting season is going to open on Monday with a gun. This is our gun buck season. You know, it starts on Monday. You know, I urge everyone over and over to just do this. Be extra safe. Absolutely, without question, wear your blaze orange. Wear the proper amount of the blaze orange. Absolutely take every precaution in the world to be extra safe with a gun. You know, every year we have some level of some tragic event, you know, but safety with a gun, a loaded gun should not be in the car. You know, without, you know, a loaded rifle in the car is just asking for real trouble. You know, absolutely be super careful if you go to cross a fence or whatever it may be. You know, absolutely teach your kids safety beyond belief, because we want them to enjoy the outdoors. The outdoors are remarkable beyond belief, and absolutely without any question, it is something that, you know, if we don't watch out, we're losing part of our heritage, and it's so vital to all of us. And so go enjoy the outdoors, have a wonderful hunting trip and everything. You'll have stories and lifetime memories forever, but at the same time, we really ask that you'll be really safe. You know, the number of hunting and fishing licenses that are being purchased in West Virginia is off the chart. We'd seen a decline in years past, long time ago, but now we're really seeing a resurgence of this and everything. And people are experiencing what you know, this incredible state that God has blessed us beyond belief, you know, with the beauty, whether it be in-state or out-of-state folks that are coming to West Virginia and or enjoying just what you have right here in your backyard is really neat. Now, we've got a couple of great people we want to recognize here, but our Secretary of Tourism, Chelsea Ruby, received an award last night. It's the 2021 Young Gun Award, you know, from the West Virginia Executive Magazine. You know, absolutely, we congratulate Chelsea in every way. She's done a phenomenal job. That's all there is to it. the work she does in tourism every day and bringing millions and millions of people to this state. It is just absolutely unbelievable. And you know, with the announcement of our new Almost Heaven campaign and all the different things that Chelsea's done, she's a real pleasure to work with. She's a fireball. She's absolutely on her game, and we just congratulate her in every way. You know, Chelsea, you know, you're a great friend, a great resource, and you have done amazing work, and we're really proud of you. Another one of our winners of the 2021 Young Gun Award was Dr. Lisa Costello, and Dr. Costello has been instrumental in assisting General Hoyer and Dr. Marsh and the rest of the COVID pandemic leadership team with her expertise as a pediatrician and as president-elect of the West Virginia State Medical Association. So in many ways, Dr. Costello, congratulations. I know really and truly you have absolutely been very instrumental in keeping General Hoyer and Dr. Marsh on the right path. There's no question that there has to be brains behind others, and without any question whatsoever, and I only say that in jest, but I really mean you've done great work, and we really thank you so much. So congratulations to both these beautiful ladies. And the only other thing is next week we're going to go with one briefing, and that's on Wednesday. We've got a lot of people out of town and a lot of people that, you know, won't be with us and will be traveling and everything. But if anything comes up that deems that we have to call people back in and be here and everything, we'll be here. But nevertheless, it's all got right now. And you know, I want to wish everybody, well, I'll see you on Wednesday before Thanksgiving.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And in support of what the governor said, the FDA, Food and Drug Administration, has forwarded the recommendation that all Americans over 18 years old that are 6 months past the second dose of Moderna or Pfizer vaccine, or 2 months past the first dose of a Johnson & Johnson vaccine should be considered eligible for booster vaccine. That recommendation goes to the Centers for Disease Control for their sign off, and the advisory committee to Dr. Rochelle Walensky, who's the director of the CDC, has made their recommendation, which basically supports the one that the FDA has pushed forward. So we do expect that today Dr. Walensky will support the idea that people who are over 18 years old who meet those criteria that I suggested about the time from your vaccines would be eligible for a booster. We know in West Virginia that having our over 50-year-old population not only be fully vaccinated, which that population has done well on the booster. If you 6 months after your Moderna vaccine or 2 months after your Johnson & Johnson vaccine, because we know your immunity has lost some of its potency. Two other things that I want to go over. Number one, there was a study that came out 2 days ago that demonstrated that getting full vaccine versus relying on native immunity confers an over 5 times more protection, vaccine versus native immunity, in groups of people who've been hospitalized and who have COVID. So it's really important that even if you have had COVID in the past, that you please choose to be fully vaccinated. That will confer more protection to you. And as the governor said, we are seeing about a quarter of our hospitalized people having had 2 vaccines in the past, and we really need them to get the booster vaccine. And that we're seeing about 9% of people who have died since we've started the vaccinations be fully vaccinated. And again, almost all of those people are over 50 years old. Well over 95% are over 50 years old. who have died who have already had the 2 shots of the Moderna or Pfizer or the 1 shot of J&J. So really important to get vaccinated. The last thing is a big study came out that was a worldwide study that demonstrated that wearing masks still is a beneficial intervention to reduce the spread of COVID-19 by 53%. It is the best intervention outside of vaccines and also can help with other respiratory viruses like the flu, like influenza, which we are just starting to see spread in the United States and here in West Virginia. So really important to use masks as an augmenting principle. The only other thing I just wanted to mention is that some people have expressed concern about a very rare side effect of getting the mRNA vaccines, particularly in young men under 30 years old, which is inflammation of the heart, so-called myocarditis. And a big study done out of Israel and published in the New England Journal of Medicine demonstrated that that side effect is extremely rare and occurs only in 1 in 50,000 people. So we know the risk of having heart inflammation from COVID itself is much higher than any risk of having any inflammation in the heart from a vaccine. So again, very important for people to consider getting boosted or to get the first vaccine series, the first 2 shots of Pfizer, Moderna, if you haven't already, because the risk of getting COVID is tremendously greater risk than the risk of a vaccine side effect in this way. Thank you very much.
Thank you, Dr. Marsh. Next to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. I'd just like to reinforce why the governor is pressing so hard and why this team presses so hard to get vaccinations as well as get boosters. We are in day 621 of the pandemic. Today, our RT value, our transmission value, is back up to 0.99 and headed to go above 1, which we know starts our trigger for additional hospitalizations, ICU patients, as well as ventilator patients. As the governor pointed out, we have gone back up in our active cases and hit 1,363 today. And in addition to that, we have plateaued and we have yet to drop below 500 in our hospitals. We know that we are going to see an additional significant increase coming forward, and we are going to be challenged again in our hospitals. The only way that we can address those issues is for our fellow West Virginians to get vaccinated, and for those over 50 to go out and as quickly as possible get the booster to protect yourselves. One other set of numbers that just highlights how significant this is moving forward. In the first 310 days of the 621 days that we've been at this, we lost 1,780 West Virginians. In the second 311 days, we lost 2,946 West Virginians, and 1,753 of those West Virginians were lost in the last 100 days. West Virginia, the pandemic is not over. The reason that the governor presses you to get your vaccine and your booster shot is it is, as he said, the one key weapon that he has and we have as a team to protect you. Please go get vaccinated. Thank you.
Thank you, sir. Next to Secretary Bill Crouch with the DHHR.
Hello, everyone. Just a quick note that the Office of Technology will be pushing out updates to the state system starting this evening. I want to mention that because the last few times that has been done, it has delayed the dashboard on Saturday morning. So these updates are done, they're scheduled on Friday so as not to cause disruption to state government, but because the dashboard is done 7 days a week, it does cause delays. There have been delays the last several months, and we wanted to alert you that this was going to happen ahead of time this time. I want to thank the Office of Technology folks for keeping us updated and operational. These updates are essential to making sure that everything works smoothly. So we thank them for that. I also want to thank our dashboard folks at DHHR. These folks are doing this 7 days a week. We have 4 individuals who start at 6 in the morning doing these downloads. So we will, our plan is to still update the dashboard tomorrow. We thank them for their efforts, and we will keep this as accurate and as up to date as possible. Thank you all.
Thank you, sir. Next to Dr. Ainam Jad, our State Health Officer.
Good evening. I just want to remind everyone to get their flu vaccines. You can get it with your COVID vaccine as well. Anyone 6 months and older is eligible to get their flu vaccine. We don't want to have, we call it a twindemic this winter season. So just want to remind everyone to get your flu vaccine along with your COVID vaccine, and also if you're up for your pneumonia vaccine as well, to go out there and get that as well. Thank you.
Thank you, Doctor. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. General Hoyer, do we have an idea of when we are going to hit 1 on our RT value? And Governor, are there any plans to reinstigate mitigation measures when we do hit 1.0, such as limiting public gathering sizes or making masks mandatory again? Thank you.
Well, Charles, let me answer the back half. I surely, to God above, hope not. But I think we've all got to be smart enough to know that we just deal the hand, play the hand we're dealt. And, I think the most profound thing is General Hoyer saying this thing's not over. We better listen to that. It's just not over. But General, maybe you can answer the first half.
Yes, sir, Governor. So, Charles, based on where we're at this week, we've had a 0.1% increase every day. So we would assume that tomorrow's numbers will see us hitting that 1.0 mark for transmission rate.
All right, thank you, Charles. Next, we'll go to Amanda Barron with Nexstar Media.
Hi, everyone. Amanda Barron with WOWK, Nexstar Media. I know earlier this week, Superintendent Birch talked about having teachers' aides inside classrooms that would help children who are behind with their learning and help the teachers be available for that catch up. I'm interested in knowing, I know he's not here today, but I'm interested in knowing what conversations you all are having when it comes to the mental health of these children. And not just how we're dealing with it inside the schools, but also how we're dealing with it, just in everyday life, how we can help these children who have dealt with so much. Thank you.
Well, Amanda, first of all, let me say this. Welcome back. Gosh, I'm tickled to death to see you, that's for sure. And, maybe Dr. Amjad, maybe can you answer this question, or is this question for Secretary Krause?
I can answer some of that. So,
okay.
Amanda, that's a good question. And, we try really hard with children across the state, not just in the school system, but even outside the school system with their mental health. So we have counselors, of course, available, not just within schools, but outside. But I think it's important for parents as well as teachers and anyone within their lives to ask children how they're feeling. But I think the COVID pandemic has allowed kids to notice that they're missing things not only in the school system, but at home, and to answer a lot of questions. But I think the teachers have done really well in the school systems, along with school nurses, to offer that. But we have noticed that kids are missing not being in person with the school. So I think being in school is very important right now. It offers that social learning and environment for them as well. So I think right now we're just doing our best to offer a lot of social services because we noticed that when kids were out of school, it didn't help them. So being in school and in-person learning is very important right now. I don't know if Secretary Crouch has anything to add with that, but that's what we did notice, that being in school was very important right now.
No, thank you, Ryan. I think that was a great answer. We are going to experience the impact of this pandemic for years to come, as we've talked about many times. But our children need the support. They need counseling in many instances where there's been there's been isolation from friends and lacking the ability to really do the things we used to do and that they used to do. Wearing masks is a concern with regard to not being able to see facial expressions with classmates or with teachers. So it's a great question, Amanda. We've talked to Department of Education on these issues, and we'll continue to do that and try to develop more services out there, counseling services and mental health services for the children, because it's important. Thank you.
All right, thank you, Amanda. Next to Paul Mullen with WCBC.
Good afternoon, everybody. Good afternoon, Governor. I wanted to talk a little bit today about asymptomatic cases. Early on, I think we heard a number that maybe as many as 2/3 of the cases were asymptomatic during the pandemic. I want to know if that has changed with the Delta variant and the fact that we have more young people being infected with coronavirus, if there are different numbers there, and what kind of danger an asymptomatic young person may present to an older person they run across at Thanksgiving dinner. Thank you.
Dr. Marsh, I think you go, and then maybe if General Hoyer, if we need him, he'll join.
Okay, thank you, Governor, and thank you, Paul. Paul, we know that about 25% of all new cases are in children 18 and under. We also know that with the Delta variant, which is much more highly infectious, and as we've talked about, can exist in, up to 1,000 times or even more greater concentration in droplets and aerosols than the original COVID-19 virus could, then in adults, this has become a much more likely symptomatic disease, particularly in people that have not been fully vaccinated. In children, on the other hand, this tends to be more likely to be less symptomatic, and in some younger kids, it's even asymptomatic. The previous virus, the initial virus from Wuhan, was more likely to be much less symptomatic because it was so much lower concentrations. So it really has changed the dynamic of this pandemic, and children of all ages can be infected and can infect others very easily because, as we've talked about, the reproductive number, and Jim Hoyer mentioned that at the state level, our RT value is 0.99 today. But when we look at the RT value of the viruses, the first virus from Wuhan had an RT value of 2.3 to 2.7, which meant that one person infected would on average infect 2.3 to 2.7 new people. The Delta variant has an R value of 5 to 8, which means on average, every one person will infect 5 to 8 new people. So the infectivity is much higher. And that's why it's so important that we vaccinate and keep people active as much as we can with their immune system, because people that are fully vaccinated and actively immune are very much protected against getting and spreading this virus, as opposed to people that are not vaccinated. And that also goes for people that have been vaccinated that now need boosters. Getting a booster raises your protection from getting and spreading the virus by about 93%, even if you previously have been immunized, but it's been 6 months after your Pfizer Moderna dose or greater than 2 months after your Johnson & Johnson dose. Jim, I don't know if you want to add anything else.
So I'll just add one example that Clay and Bill and I were made aware of day before yesterday. 2 individuals in their 70s, one unvaccinated, the other with the booster dose already. The unvaccinated individual contracted COVID and unfortunately succumbed to COVID. The individual with the booster dose had what was the equivalent of hay fever circumstances. The booster doses work, the vaccines work, and that's the best way to protect yourself and each other.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi, Dr. Marsh touched on my questions. I'll pick up from there. One of the reasons people don't get vaccinated is a genuine fear of adverse side effects and death. And fear isn't something to make light of. I know there's a kind of an adverse side effects website out there. I've tried it and it's not very user friendly. I don't remember if it's NIH or who that has it or someone else, but I wonder if we have numbers on how many people have actually died as a direct result of the vaccine and what percentage that is of the total number of vaccines given. Thanks.
Dr. Marsh, go please.
So thank you, Governor, and thank you, David. There is a website on the vaccine adverse experiences, the VAERS system. And the number of complications or side effects from vaccination is very, very low. The issue about who has died taking a vaccine is also sometimes very difficult to discern, because if somebody did die around the time that they also were vaccinated, making that connection of causality is difficult. But remember, David, we have administered about 450 million vaccines in our country, and worldwide 7.4 billion vaccines have been delivered. And you know, when you talk about the side effect profile in general, you're talking about maybe hundreds of people in our country as part of this web reported system, and very, very few people dying. So I have posted that website on Twitter. I'm happy to share that again. As I said, one of the concerns of people related to boosters in younger males is the risk of myocarditis, which tends to be also self-limiting if associated with the vaccine. But a recent study from Israel suggested that that side effect using the Pfizer vaccine was only 1 in 50,000 vaccinations in this age group of people. So ultimately, these vaccines are remarkably safe, are incredibly effective, have saved many lives, but that website does list the various categories that can be associated with vaccine side effects, and also lists any known deaths, which are really less than 100 as I remember. But that is posted, and I'm happy to share that with you.
All right, thank you, David. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, I have a question for General Hoyer and Dr. Marsh regarding the numbers that were delivered by General Hoyer during his initial statement about deaths during the pandemic. Let's delve into those, and what can we attribute to those numbers? The vaccine has been pretty plentiful. We've given out a bunch of vaccines and now booster shots in West Virginia. Dr. Marsh, General Hoyer, how do we see those numbers happening, especially the number of deaths over the last 100 days? Thank you.
General, maybe you start.
Yes, sir, Governor. So, Kenny, I think we need to understand that the Delta variant has had a monumental impact on the unvaccinated population in our state. And if you look at the numbers that the governor talks about, that Clay, Ian, and Bill talk about related to the percentage of people in hospitals, particularly those on ventilators and those in ICU, they are primarily unvaccinated West Virginians. And we know now that most every one of our sequencing samples that comes out are Delta variant or some kind of expansion of that. So I turn it over to Clay, but I believe that's a large portion of it, Kenny.
Yes, thank you, Jim, and thank you, Kenny and Governor. Kenny, we know that the Delta variant, as Jim said, is tremendously more infectious and is delivered at a 1,000-fold higher inoculum than the original virus was. And when we look at the country of India, which was the first country to really see the Delta variant, that's where it originated, over a 10 to 12 week period of time in a country of 1.3 billion people, the official death toll was 400,000, but some very credible researchers went in and looked at all the records and went to villages and interviewed people. And they think the death toll in 3 to 5 or in 10 to 12 weeks in India was more like 3.5 to 5 million people. So this is an incredibly infectious virus. Rochelle Walensky, director of CDC, who was the head of infectious disease at one of the Harvard hospitals, Massachusetts General Hospital, said this may be the most infectious respiratory virus she's seen in her professional lifetime. So the potency of infection is really different. And as Jim said, the unvaccinated are really bearing the brunt of this, but also people that have been vaccinated a long time ago, particularly people that are older than 50 years old, are also at some increased risk now, which is the reason why we're really asking people to please get your primary vaccination series. And if you've had that and the time duration is appropriate, please get your booster.
All right, thank you, Kenny. Governor, I'll turn it back to you.
Just 1 second, Jordan. I just want to make myself a couple notes. Okay. And again, just listening to our experts and that have spoken with you today, I want to just kind of summarize just a second here. You know, over and over and over, we come in front of you and we say, and I especially say, that we're going to be respectful of our freedoms. We're respectful of people's choice. We think this is the foundation of what has built this entire nation. And at the same time, we also know that all of us pulling the rope together is absolutely the key to all the success that we've had. We also know that without any question, the more of you that are vaccinated, the less people will die. Now, we ask every day, we plead with you every day to get vaccinated and get your booster shots. And we drive an unbelievable amount of mileage. You know, probably today will be, 500 or 600 miles. And we do it day after day after day. We take baby dog out, we give stuff away, we absolutely encourage and continue to encourage, and we get more and more and more people. Now we're probably reaching, somewhere a number like 250,000, maybe even more than that, since we started, that we've gotten across the finish line and we've gotten either partially vaccinated or completely vaccinated. In all of that, if you'll just step back and listen to Dr. Marsh and listen to the fact of how safe these vaccines truly are. Literally, he has told you over and over and over the safety level and the efficiency level of these vaccines. I've told you, General Hoyer, Dr. Amjad, Secretary Krause, over and over and over we've spoken, and there's been people that have come in and given testimonial after testimonial. And what do we all say? We all say just this: we're respectful of your rights. We're respectful of your freedoms. But absolutely, without any question, all of us know, all of us truly know that you need to be vaccinated. We also know just something that's come out just here today, and just this, that in the last 300 days of this, the first 300 days were really frightful and really difficult. And we had a lot of people die during that time. We didn't have a vaccine, did we? And we absolutely still had a lot of people die. And then all of a sudden, along came Delta. And we then had vaccines. And we had a lot of people vaccinated. And along came Delta, and we've had twice as many people die in the last 300 days. Now, without any question, and General Hoyer hit it right in the bullseye, and so did Dr. Marsh. Without any question, what has Delta truly attacked? Primarily, it's truly attacked those that are unvaccinated, and lots of people have died. Now, what else is right around the horizon, and you've got to think about it. Right now, RT level, 0.99. We all know at 1.0, more people are going to the hospital. We absolutely know that from the standpoint of just falling straight down, reaching a peak and then going straight down, we should have fallen significantly below 500 and some odd people that are hospitalized, and we haven't done it. We fell, but we plateaued. We absolutely know it's going to get cold. We absolutely know that our RT level is right at the threshold where more people are going to the hospital. We can stop this. We can stop it. But we got to get you vaccinated. We also know that Dr. Marsh said in the studies that are out now, as far as natural immunities versus the shots, there's no comparison. No comparison, according to, if you are listening to his words today. We also know that this Delta variant has really taken a toll. And General Hoyer said it the very, very best. And I wrote it in real big print right there. And those words, because I always make notes when they're speaking and everything. And his words are, this is not over. It's not over. If we want to live this same Groundhog Day forevermore, our ticket to doing that is not get vaccinated. And absolutely with all in me, I can't fathom how someone made the choice to get vaccinated and then is messing around with the idea of not getting their booster shot. I mean, that is completely not comprehensible to me. If you made the decision to get vaccinated, you need to realize point blank that you absolutely are not carrying around immunity right now if you're 6 months out from either Pfizer or Moderna or 2 months out from J&J. So in other words, you really and truly are just walking around like you haven't even been vaccinated at all. So with all that being said, we drive and we carry baby doll and we give stuff away and we talk and we come on here and we plead and plead and plead with you. Odds are, and it doesn't take a rocket scientist to figure this out, odds are RT value's up. It's going to get cold. There's absolutely every reason in the world to believe that this thing could get worse. It could get way worse. This Delta variant we know is so much more contagious. And absolutely, we tell you over and over and over, the simple facts is what we have got, and we do not have any other thing in the arsenal. Nothing. We don't have any other thing in the arsenal. Is it satisfactory? And then I'm done. Is it satisfactory for us to lose from 20 to 100 people from now on? Is that what we're going to do? Or we're going to say, well, we're just going to live with it. And we're going to lose 20 to 100 people from now on, every other day. Every other day, that's how many people we're going to lose. Are you happy with that? Well, I'm sure not. I mean, for crying out loud, we can do something about it. You know what's got to be done. I love you with all in me. You know what's got to be done. We got to get our booster shots. We've got to get vaccinated. Thank you so much.